Well, it is exactly 2 o'clock where I am in this country. I know everyone else may be in a different time zone. My name is Amy Pisani. I am the CEO of Vaccinate Your Family, and I want to thank everyone for joining us today for this very important discussion on supporting community-based organizations, or CBOs. So earlier this month, Vaccinate Your Family and Dia de la Mujer Latina, we partnered to release a new report, and it is called Supporting Community-Based Organizations to Reignite a Culture of Immunization. The report is detailing the shortcomings of the government agencies' COVID-19 responses in relation to CBOs. And the report also highlights the deeply impactful work done by CBOs around the country to help turn the tide of COVID-19 vaccination over the last 2 years. And the report also offers recommendations for better engaging and centering CBOs in public health outreach for the foreseeable future. Today, we will begin with a presentation from Vaccinate Your Family's Chief Communication Officer, Erica Dewald, who will be highlighting the key findings from our report. Data on federal vaccine confidence funding was provided by our research partner, Avalier Health. Following Erica's presentation, we will hear from CBO leaders who've been working in communities across the country to increase COVID vaccination. They will share their experiences leveraging the trust gained as community stewards to promote vaccination and other health initiatives. And then we will close the session with our recommendations for improving funding and collaboration with CBOs for the years to come. It's our goal to finally close the gap on vaccination disparities. And if that is the case, then CBOs are a vital part of the vision for a healthier future. And we must make reforms to better support them. Now, I would like to start out by introducing our report partner, Dia de la Mujer Latina. And DML is a Texas-based nonprofit established to promote healthy behaviors within underserved Latinx communities. Our good friend DML founder, Venus Genus, will now share opening remarks. Venus?
Thank you, Amy. And it's been a joy working with Vaccinate Your Family, the team, Amy, with your leadership. Thank you so much for at least acknowledging the value of this integration of communities and all around the country to come together and start voicing their concerns over they feel like they're being dismissed from federal funding, from federal protocol development and strategic plans. And so I think this is important conversation to have, but more importantly, it is that partnership that is critical in order for us to get through this hurdle that we're going through with the pandemic and the hesitation that we're seeing lately with vaccination. So thank you, Amy. Dia de la Mujer Latina has been just since February 12th of 2020 on top of COVID-19. Felt knowing our community and knowing the history of mistrust in our community, that we were going to be impacted by all the misinformation. And sure enough, ready, our community health workers were ready, and our promotoras. And so I think this is an opportunity for us to share how successful we have been, but how frustrated we also have been with the feeling that we are still seeing as a thought. So thank you, Amy, for the partnership, and I look forward to many more years.
As do I. Wonderful. Well, thank you so much. And now we're going to hear from Erica Dewald, who will go over some of the findings from the report.
Wonderful. Thank you so much. Thank you all for being here. We're looking forward to a robust discussion with the panel. And so I just want to go over some of the report findings briefly to ground us in what the report says, as I know many of you probably haven't had a chance to read it yet, although I suspect you all run out and do that immediately afterward. And we'll be sure to drop that link in the chat. If you have questions about the report or for the panel, please feel free to drop those in the Q&A. That way we can keep track of what has been asked and what we need to still answer. So our report looked very specifically at the federal funding of community-based organizations. It's going to take hundreds, if not thousands of us and millions of pages and reports to pick apart everything that happened during the pandemic and what we can improve upon. But we wanted to look at this very specific slice because, as both Amy and Venus noted, community-based organizations are the groups to actually change the way people think about immunization and to change the vaccination rates. So While $4.8 trillion was spent during the pandemic to make sure that people stayed employed, or roofs over people's heads, et cetera, a much smaller portion of that was given to public health. Understandably, there was a lot that needed to be funded during that time. But of the 120 billion given to public health measures, just 500 million was reserved for community efforts. 500 million is nothing to sneeze at, right? That's $500 million. And so we wanted to look at, was this small piece of the pie given to the right organizations? Now, how we did that is we held 5 programs, which you'll see, grant opportunities, against 3 specific measurements. The first is response time. So how long did the government give groups to respond to these funding opportunities? We realized we were in the middle of a crisis. We had to move quickly. But a lot of groups were not yet set up in the federal system, which can be a time-consuming process. It can take up to a month to make sure that you get all the proper permissions and codes, et cetera, to apply for federal grants. So did grant programs, applications allow people enough time to respond? Second, what was the length of the projects proposed, right? We all know it takes a long time to build trust, to build workforces that are trusted within communities. Did the project length allow people enough time to really mount the sorts of efforts we needed to change the tide of public opinion at the community level? And then finally, were there any conditions on the types of groups that could apply? Any conditions on how the money had to be used that would either encourage CBO participation or discourage CBO participation? So we looked at 5 grant opportunities total, 3 from HRSA, 2 from the CDC. And the HRSA particular opportunities you'll see are listed along with how much was given within each of these programs, as well as the number of awards given, which can give you a sense of the size. If you want to see all the organizations listed and how much they received, that's all available in the appendix of our report. We're not casting judgment on any of the groups that received funding. Everybody was doing very important work. We really just want to look at how the government made those funds available. So when we looked at the report, the opportunities from HRSA, we found 3 fairly universal problems. First is response time to the RFP. We were given a month, which was sometimes enough to get into the system. Some of these awards were less than a month, and they actually waived some of the requirements necessary to receive federal funding. What they said was, if you are selected for this grant, you can then do all of the paperwork on the back end, which is nice, but many community-based organizations are not equipped to respond to RFPs within 2 weeks. I don't think Vaccinate Your Family could respond within 2 weeks. It would certainly be a push for us, and we're a much larger organization with experience applying for federal grants. So that was problem number 1. Problem number 2 was the length of the programs themselves. They ranged from 6 months to 1 year. And they were requiring people to recruit workforce within the communities, train those individuals to go out into the communities. And unless you're set up like DML is, right, where you have a group of community health workers and promotories who are ready to go, it puts you at a disadvantage. And you might look at that timeline and say, well, there's no way my organization could do this within 6 months to a year. And finally, they had some well-intentioned conditions within these grant applications, but some of them unintentionally kept CBOs out or expanded the definition of a CBO. So for example, in one of the grant opportunities, they defined a CBO as any group working within a community for at least 6 months over the past 2 years. And as any CBO knows, they work every single day, not just 6 months out of 2 years, and most have been on the ground for a lot longer than 2 years. CDC, on the other hand, did a really excellent job of setting up their grants so that the money could get to CBOs. The response time for these grants is unknown. They were offered to specific organizations with known connections to community-based organizations, but they had really robust project timelines. They have said that they will offer funding up to 5 years which is the kind of investment that we're looking for CBOs. The downside of that, of course, is CDC and their funding is subject to the federal government, and the federal government has a lot of competing priorities in any given year, let alone in pandemic years. And so it is incumbent upon us to keep the pressure on Congress to make sure that funding does follow through for the next 5 years. And finally, what was really fantastic to see in the CDC grant opportunities was that their conditions guaranteed that money would make it to the community level. So they required that these organizations identify community-based organizations as partners. And in some of these, it was even a specific percentage of the funding had to go to the community level. So it was guaranteeing that money would reach. So that is all I want to talk about right now so that we can get us moving to our panel. So I want to welcome Venus to come back and help me run this and also offer her own insights into some of the questions. But I also wanted to introduce to you each of our panelists. So first up, we have Ms. Janice Mathis, Esquire, who is Executive Director of the National Council of Negro Women. It's an organization of organizations celebrating over 85 years of leading, empowering, and advocating for women of African descent, their families, and their communities. She formerly worked as a Vice President for Legal Affairs for the Rainbow Push Coalition, where she spearheaded civil rights and diversity initiatives with many Fortune 500 firms. And she is just a powerhouse. So we're excited, Ms. Mathis, to have you here today. Thank you for joining us. Second, we have Ms. Paulina Sosa, MPH, is the founder of Latinx Voices, a grassroots initiative aimed at uplifting Latinx stories, culture, and health. She's worked for more than 15 years in public health. She doesn't look it, just like I don't look it. We started when we were 10, I believe, including advocacy, data analytics, and communications. She's worked at WHO. I'd love to hear some of those stories. WHO headquarters, as well as at the Pan American Health Organization, or PAHO, as the lead data analyst on influenza. So her reach into infectious disease goes deep. And then last, but certainly not least, we have Jessie Rodriguez from the Figaro Wu Foundation. That's an organization focused on community wellness by targeting hunger, fighting racial and economic inequities, and providing an inviting space for learning and cultural engagement. Their work has brought a food pantry, a sliding scale clothing closet, and other key services to the Pilsen neighborhood of Chicago. Welcome, Jessie. Thank you all for being here. So to start us off, I just wanted to give each of you the floor to talk a little bit about your organization and what you are doing. Also, any early insights into what you saw with the CBO's effort. So Ms. Mathis, can we start with you, please?
Well, first of all, let me thank you, Erica, for being a great partner to NCNW. We couldn't have mounted this effort without Vaccinate Your Family. You and Amy have been terrific partners for us, and I want to acknowledge that from the very beginning. In terms of NCNW, we had a long history of health equity work going back to the early days of HIV and AIDS, where we deployed across the country to historically Black colleges and universities to talk about safer sex, and we distributed condoms and other information. So we had that deep engagement. And for many years, we hosted something called Black Family Reunion, where 1 million people gathered from across the United States on the National Mall each year to get information and inspiration. When we were approached about the CDC funding, let me make clear that we were funded under one of the CDC projects. We had the benefit of a long-term offer of engagement, the 5-year offer of engagement. We don't know how long it will last, but it's been a little over 2 years, and we just got the invitation to apply for year 3. What made us a little bit of a unicorn, I think, was that we are a national organization. We're headquartered in Washington, DC. We try to follow policy issues carefully across a range of issues, but we also have 300 sections. You might think of them as chapters in virtually every state in the country and many, many, many communities. And so we had this national perspective, but also a very local engagement, doing everything from aid and assistance to the homeless, to children in foster care, to families facing various kinds of adversity. And so we opted to apply as a national organization with local reach. And that is the way that we were funded. We also included As an additional element, along with Vaccinate Your Family and Trust for America's Health, the Panhellenic Council, which is an organization of 9 Greek historically Black sororities and fraternities who exist to do community service at the community level. So we were fortunate in that respect and having the right kind of structure to respond. In terms of response time, I don't know if our team has gotten over yet. I'm the Grinch who stole Christmas of 2020, because we worked feverishly for about 6 weeks was the amount of time we had to get it together from mid-November to late December in order to, and we had not had a federal grant in a decade prior to that. So we had to re-register, we had to think about what our inputs would be, what our logic model would be. The process had changed. None of our staff from a decade ago was still with us. So we were very much flying by the seat of our pants, but we were successful and we're grateful to do the work.
Love that. Thank you. And I have at least one colleague on the phone right now who's very excited at the mention of logic models. It is not me. Thank you, Ms. Mathis. Ms. Sosa, did you want to offer some opening remarks?
Sure. Thank you so much, Erica. And, just want to kind of echo what Ms. Mathis said. A big thank you to Vaccinate Your Family and, of course, to the Mujer Latina, just for inviting Latinx Voices and our task force to be a part of this call. I'm also very happy to say that we've partnered with the Mujer Latina since really the inception of the task force, which started at the start of the pandemic back in March 2020. So we've been very privileged to work side by side with all of the great work that Dia de la Mujer has been doing across the country, really. And so I think just some brief remarks before we dive into the panel that I'd like to share. For those on the call that may or may not know of what we've been doing the last few months, I'm excited to say that we partnered with World Voices Media under a grant from HHS, from Health and Human Services, and it was for the Juntos y Podemos campaign. So some of you may recognize that as that big blue map, and you saw that probably from different companies and organizations that were part of the campaign. But we had a very exciting privilege to do a 14-city tour since March of this year. And in that 14-city tour, we had the opportunity to actually meet many of our partners in person. And this really drives home the message that really the power of community change and impact comes from the community itself. And so what we recognize, so I'm actually based here in San Antonio, Texas. We traveled to 7 cities in Texas and 7 cities outside, and I'm actually going to include San Juan, Puerto Rico, and actually want to make a special note to our colleagues in Puerto Rico that our hearts and our prayers are with them as they're overcoming this hurricane that they're in the middle of right now. But one of the things that we saw the most of, and this is definitely going to be one of our driving messages as we get out of this pandemic and as we move into next steps, that the Latino community is not monolithic. And I think this is something that many of us on the call probably already know, but I think this is something that we want to drive home, especially with our national counterparts and our federal colleagues, that when funding is diverted into the Latino community, every community is unique. And so we had the chance to go city by city, all the way from Houston, Texas to Miami, Florida, to Las Vegas, Nevada, and you see that the community is unique. And part of that is they all have different histories, they all have different roots, they have different dialects, different types of Spanglish. Maybe some of you on the call are from some of the cities that we traveled to. And what we found is that we had to really sit and learn about the community. What are the efforts that you're already doing, and how can we support? How can we celebrate the work that you've been able to do to really bring this information around COVID vaccines, COVID information to nuestra comunidad? And so that was one of the really big takeaways from this tour. Of course, there's a lot of others, but I think one last thing I'll share before closing out these remarks is just that every community has such a powerful story in how they came together, right? And I think this really defines who we are as Latinos, right? Across the country, whether it's health specific, whether it's education related, whatever the topic and whatever the struggle is in that time, we have a way of really coming together because our culture is really big on family, on resilience, on really overcoming the struggles that we're facing. And so we were able to hear some powerful stories, not just from promotores and community leaders, but from small businesses, from artists, because what we saw in this pandemic is an intersection of different sectors that play a role in how we overcome something together as a community. And so it was such a privilege to be able to do that. And we're excited about, we have now over 150 stories that we're going to be slowly launching out as we move forward. And then one last thing I'll say is happy Hispanic Latinx Heritage Month. I think this webinar is an exciting moment to fall in the middle of this month. So thank you again, Erica, and looking forward to the panel conversation.
Thank you so much. And I look forward to seeing those stories. And I hope everyone on this call will be able to lift those up because that's fantastic. So, you spoke a lot about the different communities. We have one community in particular that we've been working closely with, the Pilsen neighborhood of Chicago. And so I'm so pleased that Mr. Rodriguez could join us today to talk a little bit about Figueroa Wu Foundation's efforts in Pilsen.
Hi, everyone. My name is Jesse. I'm from the Figueroa Wu Family Foundation. I want to apologize if I leave the call because my internet's a little bit working. It's not working, so it might end abruptly. I again want to thank the Vaccinate Your Family for everything that they've been doing. It's been a great partnership that we've been working with them, and we hope to continue this partnership. So our organization originally started as in a closet in the Dr. Figueroa, who's our director's clinic, and her whole method was that she was treating clients in the office, in the clinic, but never outside. So she provided resources for them to take healthier food options home, whether it be produce, fruits, health, beans, rice, things of that nature. And because of the lockdowns, she had to close up that closet in her clinic and then move to the basement of an old church. And from there, it just grew. The demands of the community were heard. Every time they would come here and get food, they would have questions about the pandemic. And of course, this is towards the beginning of the pandemic, so everybody was kind of trying to still figure things out. And it became noticeable that the questions weren't being answered directly to let's say, the Hispanics in the community, because there wasn't a lot of information being pushed out there that was Spanish for Spanish-speaking clients or Spanish-speaking residents only. And then as time passed on and more funding came in for the vaccinations, or for the for COVID, then we were able to focus our efforts in not just walking the neighborhood and canvassing with information, but also just becoming a place where our clients just could get help with health literacy, and that's just having information readily available, or having discussions openly on their thoughts against or for COVID vaccinations. And it really became a place where we weren't really trying to push it, but just a place where people can come and ask questions if they have questions. Now, we did offer flyers, and we did have information all over the building that would help them with that. And also quarterly, we would try to have vaccination events during our family events. So whether it be the back to school events where we give away school supplies, or the winter wear giveaway where we were giving away winter wear in the wintertime, we would often have vaccination, COVID vaccinations or flu vaccinations here available for people to come and just have for free. And from there, it kind of grew to other neighborhoods near us that we were working with, started to see our efforts and asking, how can we get involved in this? Or can we send some of our people here to your way because they have questions? And sure enough, over time, it just became a place where we were answering questions as opposed to giving away or pushing information on people, because as Paulina said earlier, and it's not all Latino communities are monolithic. So you do have just different voices and different opinions from all over the world that are Hispanic or Latinos who have concerns. And in this time of misinformation, it became very important for us to be a place of just facts, of just giving the information that we have and passing it on to them, or if they have questions, showing them how to do the research themselves, because that also became an important factor where they wanted to share that with their family members, but their family members didn't want to come to the pantry or didn't want to come on a phone call. So we were showing people how to research their information on their own, so that way they can speak to their family members who were anti-vax.
I love it.
And yes, that pretty much sums it up.
No, keep going. I was just gonna say, I love that. I'm all about how can we meet people where they are, right? Acknowledge that we don't know better than anyone else, right? We just have to present the information and let people make their decision.
That was pretty much how that's how we came to be. At first, like everybody else, we were trying to figure things out, and we wanted the best. We wanted people to be healthy. We wanted people to not get sick. We wanted people to live a long, healthy life, which is what the pantry is about. Whether it be food insecurity, home insecurity, whether it be them needing physical therapy or any social services, we will try our best to help them out. And during the pandemic, it just became super important to pass this information along to our residents, to our neighbors, to our family members. It's just and it became just we'll meet you where you're at. I don't know for sure. I was learning as the process was going, and the more that I learned, the more happily I was able to share that information with my neighbors.
Love that so much. Okay, so as everyone can see on this call, we have quite the depth and breadth of knowledge right here. So if you have questions, please drop them in the Q&A box. We would love to get to as many of those questions as possible. But right now, I want to turn back to Ms. Janez, who will start us off with our first question.
Yeah. And again, I applaud every one of our panelists. Thank you so much for being with us. And I applaud learned how to specifically go to groups and cities and learn from each of these cities, especially and Jesse. So thank you again for going to our Latino community. As you know, we're made up of 22 different countries of origin. So it's important for us to go city to city and learn from our communities. So, Erica, you and I are talking a lot about what does it mean to have an effective community engagement? Well, for us, there's a lot of definitions about engagement, but in its simplest form, community engagement seeks to better engage the community to achieve what we call long-term and sustainable outcomes and build relationships, decision-making, and of course, implementation of programs. But to be successful, guess what? The community, and especially those community-based organizations who for years have dedicated their mission to address the challenges faced by the very many people that they serve. When you talk about a model, it is a framework of guiding principles, strategies, and approaches. These approaches need to be culture tailored for each of these communities. The framework is based on principles that show respect of the right of every community member to be, number one, informed, number two, consulted, number three, involved, and number four, empowered. And that's what we believe a community engagement is. And I'd love to hear from the other panelists. What is your way of defining community engagement coming from the perspective of your community? So Janice, start with you.
Certainly. I can't disagree with your definition. NCNW certainly has a practice of engaging our members at the local level. They determine what our agenda will be at the federal level, at the national level, but they're also very much in tune with what moves their community, where the soft spots are. Whether you're talking about faith-based organizations, or you're talking about educational leaders or civic leaders, or the business community, just as you said, someone said about the Latino Hispanic community, not all Black communities are the same either. They differ within one community. You've got various occupations and socioeconomic backgrounds, and age is a big factor in the Black community because you've got younger population who don't want to hear a thing that people my age have to say. If it didn't come to them on TikTok or YouTube, they don't believe that it's really news. So we have some of those same challenges, but the challenge to us is to make sure we engage as many of those segments as we possibly can. And we think we did a reasonably credible job of doing that. But you're right. I quoted someone not too long ago who was a leadership theorist. And he said, if you want to lead people, you have to leave them with the feeling that the progress they made was progress that they themselves created. And so we're very much guided by that. I think that's what I would say about the diversity of the communities and what it takes to engage them. It takes a lot of legwork, a lot of phone calling, a lot of meetings. We have lots of gatherings where we invite the entire country or an individual community to gather with us for the COVID conversations that Vaccinate Your Family helped us establish, our own community of practice calls twice a month that are open to anyone who is affiliated with our Good Health Wins network. So you're right, you have to do a deep dive in order to get communities to feel as if they own whatever it is that they're working on.
Absolutely. Invested in the project as a team member, right? Absolutely.
Yes.
Janice, how about you, Paulina?
Sure. So I have to echo everything that Janice and Venus have said already. I think it's important for the community to feel empowered. Kind of comes back to that concept of ownership on what happens, on the kinds of interventions, the kind of work that happens. And I imagine that there are actually many community leaders and organizations on the call now. And so, I'll go ahead and actually take a quick moment just to say a big kudos to you, because I think what we saw during the pandemic and what all of us have experienced is that the pandemic was not a 9-to-5 job, the pandemic response. I mean, this was a constant day in, day out response that really required us to work together. And I think one other thing that we can really see, and something that we saw on this tour, on the Juntos Si Podemos tour, we actually called it the Latinx Boost Up Tour. And part of that was because, yes, we were promoting vaccines and the booster shots, but we also wanted to, kind of along the lines of this term empowerment, we wanted to empower community leaders, small business owners, promotores, by giving them a voice. And we gave them a voice through hearing their story. And I think one of the things that we realized is that a lot of us are ready to share our story. A lot of us want to share our story, and being given a platform to just be heard, be listened to, really makes a difference. And so actually we're still bringing in stories, and I'll actually just make a call to anyone on the Zoom now that if you have a story you want to share about what you and your organization did, we'd love to hear it. But I think it really comes down to giving the community the tools that they need in order to run with it. Because what we saw is that they've been doing it. Many organizations had to get creative and innovative with or without funding. Many organizations didn't have the funding to do what they needed to do regardless during this pandemic. And so now that we have time to do this, to do what this report is doing, to reflect on what happened, what went well, and what needs to be strengthened, this is definitely one of those things. How can we ensure that communities continue to have an active voice, not only within their community and their state, but around the country? So thank you.
How about you, Jesse? Thank you.
I too would like to echo whatever everyone else has been saying. They're pretty much on point with getting the community involved. I mean, this is why we're doing what we're doing. I also want to add on that, right or wrong, we more than anything try to show our intent to our community members. We try to show them that we are here for them, that we're here for their benefit, that we want to engage in conversation, that we're here to grow as well. So there is definitely a level of humility that we have to present when talking to community members, because we don't know where their background is, and we're trying to engage with them in an honest way, and not in a place of we know better than you and this is what you should be doing, because that's never the mindset that we want to have, nor do we have. Just because we're all just growing and learning as time goes on. Especially during the beginning of the pandemic, there was so much misinformation going on that there was a lot of confusion and a lot of irate people that we had to sort of just engage on a personal level. Just become a place of trust, a place of, if we're wrong, we'll admit that we're wrong, and then we'll work towards a better solution. But I couldn't agree more with what everybody else is saying, that it's just a matter of putting our feet are just putting our boots to the ground and just talking to people wherever they're at, and just making sure that they're heard if they have any concerns.
Venus.
Yeah,
also like to have one more thing, if possible, always, and we always try to go against across the aisle, which is much more easier on the macro level when it comes to the politics of people, individuals. it's a lot easier to engage with people like that because they live in your community. Therefore, we both have a common interest. So we try very hard to get people from the other side because oftentimes they give us a perspective that we don't have. They help us look into where there's shadows and things that we can't foresee because we're focused on this side of the aisle. So we try very hard to get everybody in the community, whether they're educational leaders, civic leaders, religious leaders. We try very hard to just bring everybody together to have everybody's opinion all in one, so that everybody is heard.
Thank you, Jesse. What I've heard from the three panelists, and I'm 100% in favor of it as well, is we need to build that trust within the community that we're serving. And we have many of our community health organizations and our community health workers. That's what they've been doing for many years. They've been building that interpersonal relationship, building that trust. I think that's key in all of these efforts, is having that trust. And I keep hearing it more and more, but people are starting to use this in a haphazard way. They are not really putting the intent of how important it is to build that trust. Any community engagement strategy needs to employ a range of culturally specific tools and the input of our promotores and community health workers to ensure success. For instance, with our organization, the moment this hit, we already had promotores and community health workers trained. By March 5th, over 3,000 had already been trained. But we also knew he needed to hear from the community. So we implemented 10 hotlines in 4 states and including Texas. And then we ended up having what we call our telehealth community navigation contact center, where we text, email, and phone anyone who needed help in navigating them through the course of the pandemic and all of the issues surrounding the pandemic, which also included, some of the mental health, behavioral health issues that we also have to discuss. And community-based organizations are key in addressing some of those mental health and behavioral health issues that we've encountered during this pandemic as a result of the depression, anxiety, stress, and stigma. It also places a significant emphasis on how we're going to be fostering and enhancing this trust to put together a long-term sustainable engagement. In other words, if a grant is only like Erica said, 6 months or a year, that's not a commitment. And you cannot build a sincere level of trust by asking a CBO to just work on these strategies and then drop them after, 9 months or 10 months or whatever, and say, okay, we need a report. Just give me the numbers of how many brochures you distributed. And that's just processes. It's not impact. And that's what we kept seeing, is that we in the community were ready to do this, but we were being told how to do it by these institutions that were receiving the millions of dollars. And we weren't allowed to share and say, hey, this is not working because this is not how we do it in our community, in our neck of the woods. So I'd love to hear from the other panelists how they felt with what's going on as far as trust. So let's start with Janice.
Well, thank you. Trust is interesting. We kept hearing the word confidence. We were charged with raising confidence in vaccines, not only COVID vaccines, but across the lifespan. And what finally dawned on me about that after many, many, many conversations, that confidence is not just confidence in a vaccine or the science or the process. Confidence is a relationship between people. And before you can inspire confidence in the vaccine, you have to demonstrate a level of confidence in the people that you're trying to help. Now, that might sound backwards, but it's easy if you are better educated, a little more fluent, maybe a little more knowledgeable about the science, to be a bit condescending about the facts and to think that you know better than these poor people that you're trying to help. But if you're going to be an authentic partner, you have to be willing to accept for what it is, their point of view, and to be confident that the people you are working with deserve your help, that they are worthy, that they are fully human, fully worthy of having good health. And if you come from that perspective, for example, we identified fairly early on that there was a population in one of our counties that we were working with of people who were experiencing homelessness, who did not have transportation to receive vaccines. Well, now that's not your typical sorority and fraternity crowd. But in order to work successfully with that community, we had to get off the high horse and be willing to say, this person is equally deserving of health equity and access to vaccines as anybody else. I think that's so critically important.
Paulina, thank you, Janice. Paulina?
Definitely. So I think building trust is actually one of the biggest reasons why we saw during the pandemic this huge rise in miscommunication and discommunication. So misinformation, disinformation, all of it just really played a role in all of the communities that we're talking about. But definitely what we saw in the Latino community was a huge lack of trust with the messengers, especially those messengers that didn't understand who they were, where they came from, or even the work industry that they were in, right? And I think, again, this really comes down to what we mentioned in the last question, right? The fact that it's important to, and Janice just mentioned this, the importance of relationships. And Venus, you mentioned this as well. The fact of the matter is that promotores, community health workers have been building these relationships for years, far before the pandemic started. And so for us to make sure that moving forward, right, we can reflect on the pandemic and see that there was a certain point in time where promotores and community health workers and community organizations were given the funding or the recognition that they deserved with the work that they were doing. But this has to continue, right, because of the importance of building that trust. And I think what we're also seeing, I'll mention briefly what some of the work that we're doing in the task force, we're actually trying to not only talk about the lessons learned from COVID-19 specifically, but now we're starting to transition to talking about other key priorities, health priorities in the Latino community. Because fact of the matter is, during the pandemic, a lot of these health priorities were ignored. And a lot of it is because just the lack of manpower and resources. But again, if we're talking about chronic disease, if we're talking about mental health, how do we make sure that we tackle these with a community specific response and with the trust that many community leaders and organizations have? One last thing I'll say is, I think Jesse mentioned this, the importance of faith-based organizations and churches. And we really saw that. I think it ranged in the different cities that we visited to, but churches, for the most part, were a huge source of trust for the Latino families that we met with. And so how can we ensure that those kind of relationships continue moving forward as well, right? And so I think there's a lot for us to unpack here, and there's a lot for us to continue to build upon, but trust is at the core of the kind of work that we do together.
Thank you, Paulina. And Jesse?
Sure. When it comes to trust, most importantly, that what I notice, what I observe is just being clear about our intentions, what we wanted to do, and our goal. And our goal was our intentions, and our goal was not to meet a quota. Our goal was not to change anybody's mind who was anti-vax. Our intent was just to provide information and provide a place where people can come, feel comfortable enough to come and ask questions or challenge our questions or our answers. A place where people can come and get vaccinations, where we did hold our events, a place of just where we respected the individuals who didn't agree with us. We respected the trust that was given to us, because just like they're trusting us, we're trusting them, and it's a relationship. It's a give and take. We grow with them, so we trust that whenever they come to the pantry or to the closed closet or the physical therapy, they're being honest with what their needs are and how we can achieve those needs. It's a relationship that we definitely honor and respect, because that trust goes both ways. And without that, we really can't do the work we do in the communities that we're in, or that we try to serve. It's providing individuals with the tools for them to do their own research, or for them to talk to their family members when they're at home, because not in the time when politics is so heightened and people are going back and forth with left and right or up and down or whatever your beliefs are. It's important to just keep that out of the conversation and just, hey, we're talking about health. We're talking about mental health. We're talking about vaccines. We're talking about kids going back to school and doing early education and being vaccinated to help, curb measles or whatever current outbreak is going on. And just providing people with that opportunity to find out for themselves has been crucial to building that trust with our community members.
Thank you, Jesse. Erica, you and I have been talking a lot about, that's how we started our conversation a couple of years ago. It's because of the funding. The funding is key to this report. And I'm interested in getting from you, what really drove you to finally put this on paper? Because I've been sharing all these concerns with you for so many years, but I'd love to hear your take too.
Sure. So, I think we have been hearing from everyone that this is a problem. And I think by engaging with great groups like DML, like NCNW, Latinx Voices, all the great groups in Pilsen, including Figaro Wu, we heard it again and again and again. You're doing this on a shoestring, if even that. And yet everyone is doing the work because you are in the communities, you are of the communities, and you see what the need is. And you're willing to meet that need regardless of whether you're compensated for your time. And as a national organization, we thought, well, what can we do? We can actually say to the powers that be, hey, maybe it's about time we started paying attention to the CBOs. Hey, maybe it's about time we started properly funding the work that the CBOs are doing. And we tried to put our own money where our mouth was in microgrant programs, right? Both through our Fair Shot program, which supported rural efforts to get the word out about vaccines, as well as within the Pilsen neighborhood. And I will sneak peek at the end, I'll be talking about some further microgrant programs that we hope everyone can take advantage of. But at a certain point, you say enough is enough. We've been through, 2 different administrations on this pandemic, and it doesn't matter, as Jesse said, what side of the aisle you're on. We're a nonpartisan organization here at Vaccinate Your Family. We just want to make sure people have access to the information. So I do want to take this moment to thank all of you for all of the work that you're doing, all of the participants on this call who are doing that work as well. I mean, you are the ones saving lives, and for that, we're eternally grateful, and we'll continue to fight this fight for you.
Thank you so much, Erica. Well, for those of you who may not know what happened to us, upon the launch of the NIH Community Engagement Alliance program, it's called SEAL. Our organization served as the so-called community partner, and we were working with this major university. And while we were bringing in all the milestones, the numbers that they needed, it was very impactful. We had our signature health fiestas, 500 people was an average of the number of people that attended our events. We were having our promotoras and community health workers in different areas, and the flea markets, and all kinds of church groups, and participating with us as well. We felt that the university had already created these metrics that are inherently biased when allocating the budget funding for community partners. A case in point, they predetermined the organization's size and operating budgets as indicators of what that community organization can do to be accountable to that particular subfunding, instead of valuing that partner's years of community work, their deep root in the community, their track record of effective community engagement and public health interventions. And so what was happening, the outcome, the result was that community organizations had to wait months to receive the subfunding for the work that had to be done immediately, or we were being held responsible to pay others out of our small budgets. And it was difficult for us to continue to sustain that and wait 4 months to get reimbursed. The community partners' work is valued by universities as shown in their reporting, but hey, universities leave community partners in the red for the work because that is grossly underfunded. And the answer here is that these practices are rooted in upholding systemic barriers that privilege larger institutions over smaller, grassroots organizations like all of us that are in this call. And we will call it out what it is. It is a subtle form of structural racism. And I want to share now with the floor with Janice and Paulina and Jesse. Please share what you have found when it comes to the funding. Did you feel that it's all part of that subtle way of or the biased way of not wanting you to succeed, or please share with us what you think?
To be perfectly honest, we did not feel that we were caught in a subtle racism kind of situation. Although it is familiar. It's not that I have not seen it. I just didn't see it in this particular engagement. And the reason I didn't see it, just like many of you, we were doing this work beginning April 2020, before there were vaccines, right after we left our offices, because the statistics started to come out that the death rate among Black folk was somewhere between 30 and 50% higher. So we had to spring into action, whether we had a grant or not. So for most of 2020, we didn't have any funding other than what we could muster up on our own. So we were committed to it. The other thing was that we immediately once we got funding, or when we designed our proposal, that it would have mini grants. We gave out more than half the funding we received, well over half of it, something like 70, 80% of it went to those 300 chapters and those 9 Greek organizations and to our 12 state organizations. Most of that money went out the door because we knew it was important to give people the tools and the capacity to manage to do their reporting, so that next time they would be in the queue and be qualified to seek funding on their own. So I guess our experience was a little bit different in that regard. And I think maybe the CDC did a better job of structuring the RFP than maybe some other granting organizations did.
I agree with you, Janice. Thank you. Paulina?
Yeah, definitely. I think this is a really critical question. I think I saw a few questions actually asking about what's next. And I think the funding piece is part of what's next. It's not the whole answer, but I think our experience, so, being such a young organization, as I mentioned, the health task force really started in response to the COVID-19 pandemic, right? And so kind of similar to what Janice mentioned, we hit the ground running with actually no funding. And I think, again, this speaks to what many of us have shared already. We did the work because we knew that the work needed to be done, and we cared about our community getting that information that they needed, that they had tons and tons of questions about. And so we're grateful that we received the funding that we did soon after we kind of started this ramping up of efforts in the community. But, I'll be perfectly honest, the funding wasn't enough, and it's still not enough. And this is something that many, many community organizations we work directly with have said as well. Unfortunately, another thing that we've heard is that a lot of COVID-19 funding is drying up. And so most of the organizations we work with do not know what's going to happen after their grant dries out. So for some, like us, our grant actually finished up a month ago. And so luckily we're able to continue moving forward, but many organizations are not sure what's next. And so I think we're really facing a little bit of a crossroads here. And I think this report comes out at a critical moment to address a lot of questions that organizations have about what's next after the COVID-19 funding dries up, because the reality is that the response hasn't stopped. And of course, now we know that the second booster is now available. And so there's still a lot of questions. There's still a lot of efforts. And I think we are all experiencing this COVID fatigue. And of course, this definitely speaks to the drying up of funds, but we need to figure out what's next in order to ensure that the community efforts can continue moving forward, because as I mentioned earlier, there are plenty of other health priorities that are facing our community that need the funding that we had these last 2 years, need that kind of funding. And so I think this is definitely a longstanding question, but I think one of the collateral benefits, so to speak, from the pandemic is showing and really putting a light on the facts that community organizations need increased funding. So I hope that this report and this webinar and many other efforts like this really go to increasing the funding that the community efforts we do need.
Thank you so much, Paulina. And Jesse, and after Jesse, I'd like to hear from Erica as far as our chat. So Jesse, a few words for you.
Yeah, I can't really speak to the structural racism that the funding was that some people felt, only because I don't really, my director, Dr. Figueroa, she's the one that deals with that. I was more dealing with the community outreach, and I will say that there was challenges. There were a lot of conversations with Dr. Figueroa where there was frustrations as far as what we could not do. But for the most part, we were very fortunate and we were very grateful to have the funding to continue to be able to do this work, because like everybody else, we hit the ground running. There was no time to wait. People were asking questions, and to serve the community, which is what we were doing, we had to figure out a game plan. There was a lot of creative ways that we had to figure out to get things done with the limited resources that we had, but we got them done because, just like everybody, our goal was to help anybody who had questions or who was looking for help.
Thank you, Jesse. Erica, you want to share what's going on in chat?
Yes, so we got a few questions coming in from the chat, and I just wanted to combine a couple of them into one. So here at Vaccinate Your Family, obviously we're still working on COVID, but now we're working on monkeypox, we're working on polio, we're working on the lower childhood immunization rates, adult immunization rates, flu's around the corner, right? That's just vaccines. As you all were mentioning, there's a whole world of factors that affect everyone's health, right? Those social determinants of health. And so if it's humanly possible, I'm not sure it is, but if it's humanly possible, as you think about this huge world, right? What is, in a world of limited funding, that one piece that you want to see continue to be funded into the future? I know that's an impossible question. Anyone want to grab that first?
I don't know that I have an answer to that, but I do think that when I look at what was going on in the Hispanic and Latino communities, that community closed the gap in COVID vaccine rates. It got to the point, I think just a month or so ago, that those communities had vaccination rates that were higher than comparable rates in all white communities. And that's important. So whatever the challenges were, you had the insight and the relationships to your communities to make progress that was significant and meaningful. So I hope that when the government funding people look at what needs to happen next, they give credit where credit is due for having closed that gap that was pretty stark at the beginning. We did a good bit to close the Black vaccine gap too, but you actually surpassed and went over and beyond. So don't let them forget that when it comes time for funding next.
I know Paulina's smiling because she knows where I'm coming from, Janice, but those of us that are Latino advocates, we are very concerned about the data, how it's being collected, how it's being analyzed, and now how it's being reported. We're not really that, how should I say? I'm sure Paulina will. Yeah, it's just because we're looking at our data, we're looking at our numbers, we're listening to the people. So we don't know how they're gathering the data, if they're using, who are they using to collect some of the data? What metrics are they using? What questions are they asking? Are they asking the right questions to get the right answers from our community? Or do they have these pre-populated questions that, they think is going to get to the root of the concerns of our community? So data is something that, I'm always concerned about, but I think going back to Erica's question, I think for me and looking at what my role in my community, it's all about health literacy. I think we need to put more emphasis on because it affects all of our communities of color. more than anything. It affects people that are limited English proficient. It affects people that have limited education, and people from the rural communities that may not have the Ivy League instructors and teachers, and some of our communities in our pockets in every city. There's always these pockets where we have a predominant community with schools that are not really fit to be tied. I mean, just not the right setting for learning in our community, and not the number of people. We hear that there's shortage of teachers. We really need to look at the health literacy component, but also the literacy component, and what we need to work on together as a team, because it's not about so much the language, but it's the intent behind that language. And there's key words that, and I share this with some of my colleagues, when you are literally translating information, you totally lose us. And that's what was happening. And just to give you a case in point, millions of dollars went out to all of these infographics, and they had these featureless faces. And if they would have asked us, we would have told them that a featureless face in the Latin American communities symbolizes domestic violence, because the woman's face is battered. But nobody asked us, so they wouldn't put all this money into all these infographics. So if somebody's going to pick up a brochure and look at these featureless faces, they're thinking that, oh, that's something about domestic violence. So again, if they would have had community-based organizations in the room as they're developing all of these strategic plans, we could have told them and saved them a lot of money by telling them, first of all, invest in a community health worker in your promotora. Let us look at the material before you send it out to print to make sure you're not offending anybody. And I'll turn it over to Paulina.
Thank you, Venus, and thank you, Janice, for your comments about the vaccines. So as I'll go ahead and just add that data is one of my biggest things. I'm actually getting my doctorate, and my whole dissertation is focused on dashboards and equity and decision making. And I think the data that we see, and actually some of the research I've already been able to do, has pointed to how surveys are conducted, how focus groups are conducted, who's conducting the focus group, what other questions they're asking. And so there is a big question mark on the kind of data that is represented. Of course, and I think I can, well, I'll say this on behalf of myself as a Latina. Many times when I'm filling out the race versus ethnicity form, I never know what to really put in the race form. And so when you're looking at a graph and you see just the racial differences, especially if it's not right next to the ethnicity, there's a whole question mark on, well, how many of these are Latinos that just didn't know what race to put. And so that, of course, is probably a much longer conversation. But I think, to come back to the social determinants of health, I agree. I think health literacy is probably one of those biggest things, and health literacy covers a lot, right? I mean, health literacy, you're talking about education, you're talking about information, you're talking about community organizations and giving them the resources and tools they need to educate the community. But I think I'll add one more thing to this as well, and I think this is something that really emerged during the tour. And education, we saw, was a really big sticking point. So I'm going to say education, but when I say education, I'm also talking about the digital divide. I'm talking about the household size. I'm talking about a lot of different components that play a part in the wellness of a household. And what does that mean, right? Where is your household located? Do you have transportation to food? What kind of food do you have access to, right? And so all of these really play a role in the kind of access you have. And we saw this during the pandemic. Do you have access to vaccines or not? One of the cities that we went to, what churches had to do was they had to drive out, and these were generally rural areas. They had to drive out because this is where a lot of the workers in the oil industry or in the meatpacking industry lived. They lived out of town. So they didn't have access to vaccines. They didn't have access to testing. So they had to take buses to bring them in. And so when you don't have those resources, how are they going to access something like a just a general diabetes test, right? Or, some of these more chronic disease related tests, or, different types of vaccines or immunizations. And so again, I think social determinants of health is a very loaded question, and we could talk all day about that too. But I think part of it is really the location of your household geographically, but also education and the kind of resources that you have access to in the household you live in. So sorry for the long answer there, but
no, we appreciate that, Pauline. I mean, really what you're talking about are those real examples that are so important. And let's have this be the start of this conversation. So the report is done. This is the first time we've talked about the report, but I think it's incumbent upon all of us now to go out there and use this report and use the information in there. Data is great, but really what we want to see is change. So I really do want to thank you all for coming here. It is my job to do a close, but I want to do so by thanking our report partner, DML, and Venus also for helping to moderate this call. To all the panelists, really for the day, for the report, but really for the work that you're doing every day that made it so essential for us to really highlight what was going on in the world. I want to extend my heartfelt thanks to the Vaccinate Your Family team, in particular, Erica Dewald, for bringing the report to life. We saw that there was an issue. The pandemic response resulted in really the bringing together of so many community-based organizations and public health staff and all over the country, and then organizations like Vaccinate Your Family, who just focus on ensuring vaccine access. So without, understanding the nuances of what you were going through, I don't think we would be where we are today. And certainly you've saved millions of lives. So again, as we move through the pandemic, we at Vaccinate Your Family were really committed to looking back with gratitude, but really calling out those areas of needed improvement. And that really does include the local businesses and foundations who decades ago used to fund local coalitions and CBOs. So it's government agencies, but also those foundations. We need to look back and start thinking about where we can move forward. Because in the end, we really just want every person in every neighborhood to get vaccinated against deadly diseases. And really, that's what equity is all about. So I want to thank you all for coming. I want to again thank Erica for putting this whole event together, and to your wonderful panelists. And for those who came today, we hope that you'll help us make the change that we really need to see. So thank you very much.
Thank you.
Thank you.
Pleasure meeting all of you.
Igualmente.
great meeting you too.
Aye.